rules. Each participant will be allotted 3 minutes to make your comments. Your adherence to this time allocation will allow all participants an equal opportunity to provide their comments. When it is your scheduled time, I will call your name and invite you to unmute your microphone so that you may begin your statement. At that time, please make sure to unmute your microphone on Zoom as well as on the computer or phone that you're joining from. If I cannot hear you, I will let you know. If possible, please consider turning on your camera if you're comfortable doing so. When you have 1 minute left, I will turn on my camera and you should begin to wrap up your statement. I will give you a verbal warning at 30 seconds and I will hold up this red card when your allotment is up. At that time, please conclude your comments and we will mute your microphone. If you are joining by telephone, I will give you verbal warnings at 30 seconds and when your 3 minutes is up. Again, to ensure that everybody signed up today for the session is able to speak, we ask that you keep within the time limit and keep your comments focused on lead in drinking water and the revised lead and copper rule. We thank you for your interest and we look forward to hearing from you. We will start with our first speaker, who is Shawshank Agarwal. I hope I pronounced that correctly. Shawshank, please turn on your microphone and begin your statements.
Thank you. Hello, everyone. I'm Shawshank Agarwal. I'm a fifth-year PhD student in the Department of Mechanical Engineering at MIT. I've been actively working on the topic of aftermath of Flint water crisis and EPA's lead and copper rule for a year now. And I'm here to contribute to EPA's efforts to ensure lead-free water to all American residents. First of all, I would like to thank EPA for giving me the opportunity to speak in this forum, despite me not being a citizen. This clearly shows EPA's commitment and willingness to improve LCRR. I hope EPA will find my suggestions relevant and useful for improving the latest draft of lead and copper rule. I would like to bring your attention to 3 major areas of improvement in LCRR. First, a small number of samples during routine testings. Second, lack of actions upon increasing lead levels. And third, lack of immediate actions upon lead level breach. So the experiences in past, like Flint, have shown that a small number of samples is among the fundamental reasons behind the misrepresentation of lead levels in water systems. Yet the current form of LCRR continues to require collecting a very small number of samples for assessing lead levels in water systems. For instance, systems serving up to 100,000 population require only 60 samples to assess the water quality in systems. I feel LCRR needs to substantially increase its minimum sample collection requirement all across systems of every size than its current values. Second, LCRR also continues to take passive approach rather than an active approach to control lead levels. The current law requires no action in response to increasing lead levels below trigger level, let's say from 5 ppb to 10 ppb. They should be doubly concerning as increasing lead levels in a system indicate ineffective corrosion control treatment, which should be addressed on time. Otherwise, it could eventually result in lead levels breach. A timely response to a statistically significant increase in lead levels would really improve LCRR. At the last, the new LCRR does make some improvement in LCR by introducing a trigger level, but still there is no provision for immediate actions upon lead level breach. The rule has no provisions for providing alternative water supply to citizens or introducing immediate corrosion control strategies to safeguard people upon TL or AL breach. In fact, the current provisions allow for 2 to 5 years before any ground results. Active and short-term immediate approaches such as addition of orthophosphate immediately after AL or TL breach without having to wait for 1 to 2 years and alternative water supply provisions would really improve LCRR. At the last, I feel that LCR is an improvement over existing LCR, but there remains many important and easy to fix issues in it. I covered a few of them here, and I hope EPA will address them in full details before implementing a relatively incomplete or weak LCR in a haste, which fails to address all the issues that I covered today. Thank you.
Thank you, Shawshank, for your comments. Our next speaker will be Sean Goho from Massachusetts. Sean, please unmute your line and turn on your camera if appropriate and start your comments. Are you with us, Sean?
Yes, thank
Great.
you.
Please go ahead. Thank you.
Okay, thank you. Hello, my name's Sean Goho. I'm the acting director of the Emmett Environmental Law and Policy Clinic at Harvard Law School. Our clinic has worked for several years on issues related to lead in drinking water. And one of our initiatives was a joint analysis with the Environmental Defense Fund of the legal authority of public water systems to use ratepayer funds to pay for the full replacement of lead service lines. Public water systems often argue that state law prohibits them from using ratepayer funds to replace the portion of those lines on private property. For our paper, we reviewed the laws of 13 states that among them contain 2/3 of all lead service lines in the United States. We found that none of these states prohibited the use of ratepayer funds to replace lead service lines on private property. This analysis has implications for the lead service line replacement plans mandated under 40 CFR 141.84. Under this provision, public water systems must replace a portion of their lead service lines every year if their system exceeds the lead action level. Under both the old and revised versions of the rule, however, utilities only need to pay to replace the portion of the line that they own. We urge EPA to return to the approach that it previously adopted in 1991. Under that approach, public water systems had to replace any portion of the line over which they had control. And further, it established a presumption that a public water system controls the entire service line unless it can show that it lacks any of the forms of control recognized by the rule, which included the authority to set standards for construction, repair, or maintenance of the line, and the authority to replace, repair, or maintain the service line. Later, however, in 2000, EPA revised the rule to require that public water systems replace only the portion of the lead service line that they own. In support of this change, EPA cited potential uncertainties about the utility's authority to replace the portion of a line on private property and state constitutional prohibitions on using public funds for private purposes. Our analysis, however, shows that these concerns are not actually barriers and that public water systems can use ratepayer funds for full lead service line replacement. We support President Biden's plan to pass an infrastructure bill with funding to remove all of these lines. Given that the outcome of the legislative process is still uncertain, however, we urge EPA to use its existing authorities to speed up the full replacement of all lead service lines.
Sean, excuse me, you have 30 seconds remaining.
Thank you. One important way to do so would be to return to the control-based approach to identifying which portions of a lead service line public water systems must replace. And we urge EPA to do so in revising the rule. Thank you.
Thank you, Sean, for your comments. Our next speaker today is Eric Schwartz from Michigan. Eric, are you with us?
Yes, I am. Can you hear me okay?
I can. Please start your statement.
Wonderful. Thank you very much to the EPA for creating these opportunities to receive public comment. The proposed lead and copper rule revisions did have significant shortcomings, and we are hopeful that the EPA will continue to listen to stakeholders, communities, and the science in order to make sure that the revised rule sets the path toward removing all 100% of the lead service lines from the drinking water system, because lead has no place in our drinking water. I'm a professor at the Ross School of Business at the University of Michigan as a researcher in applying statistical modeling and machine learning methods to managerial marketing decision-making. And I am also here as co-founder of Blue Conduit, a social enterprise that uses quantitative methods to support public health. We started Blue Conduit as a social venture because of the research and work that we did in collaboration with the city of Flint, Michigan, during its lead service line replacement program. And beyond Flint, our team has now gone on to help over 50 cities and water systems in accelerating their lead service line replacement efforts. Today, I have the following comments to provide to the public and to the EPA. Number one, we're advocating for what we'll call a community engaged service line inventory. Number two, the advice of following the data and the science. And number three, on the path to 100% replacement of lead, order matters. To the first point, what do I mean by a community engaged inventory? It's an inventory that is not just a list of addresses as a PDF posted to an arcane website, but it's an inventory that explicitly works to take into account the experiences and perspectives of the communities most affected by the lead crisis in America. These are communities of color, disadvantaged communities, and lower resource communities. That community engagement can take many forms. One very clear way is by being more transparent. We're advocating for a public inventory that is explicitly a public map, that is an interactive map on the internet that is allows anyone in a community or outside that community to look and find out the presence or absence or uncertainty about lead service lines. This isn't about calling out or scolding a utility or water system. It's about more information presented
Eric, you have
appropriately
30 seconds left for your
Yep.
statement. Thank
to
you.
communities that can empower residents. Activists in Flint have been using flintpipemap.org to help the city find its fellow residents who have not been able to have their lead replaced. So the second, by using the data, we can better understand that replacing all of the lead means you need to replace where you know the lead is first, that we can worry about the least likely chance of lead areas later, but let's reduce the total number of days that communities and individuals are living with lead service lines. Thank you so much. That's all I have for today.
Thank you, Eric. And now for our next speaker, I'm going to turn it over to Matthew Lefleur from Vermont. Matthew, please unmute your line and make your statements. Matthew, are you with us? If you are speaking, we cannot hear you.
There we go. It somehow is disconnected, and Zoom, you know how Zoom is, these days,
Yeah.
Yes. No,
Thank you.
Yes, I'll continue. Thank you very much, everybody. Yes, as I was going to say, I agree, support the EPA on, removing the lead pipes, from not just, from my state, which it has been basically, been ingrained for years, and to a community base, which I agree with Erickson on place, and probably, have a bipartisan, with the, elected officials, so we can find a way where we can move together on how not only tackling those issues, where are these lead pipes are, what can we do that will be most cost effective in a meaningful way that basically would help communities, not in my state of Vermont, but I see this as a whole around the United States of America issue. These lead pipes been here since for 1960s, probably for so long that, we don't even know what the root cause of these lead pipes, and what conditions they are in. And they are, from what I'm getting from community members, advocates, people with disabilities, and I'll say that again, very emphasize on that hard, that they are at the mercy of these lead pipes, that we should, try to get these lead pipes removed as quickly as soon as possible. So, so not just where it's, one problem is kind of like an enigma version of that problem. It has so many outlets where lead can corrode, pipes can corrode in places where it should be like the root cause of it, trying to find it, identify it, and try to fix it in a meaningful way where community members, public, entities, and, advocates, government officials can take heed to those issues, pressing forward so it will better serve everybody's needs. Thank you for your time.
Thank you, Matthew. Our next speaker is Joseph Catruvo from Washington, D.C. Joe, are you with us?
Yes, I am.
Please go ahead. Thank you.
Hello, EPA. As you know, I was Director of Drinking Water Standards when the original lead and copper rule was contrived 30 years ago, 32 or 3 years ago, actually, published in 1991. So I have an abiding interest. First of all, I agree that it is appropriate for EPA to withdraw the January 2021 rule and revise it to make it more effective. I think there are two very important issues to be addressed very quickly and first, and that is, why has that 30-year-old rule not been fully implemented across the country in all the states? And number two, why hasn't EPA dealt with those states to mandate that they enforce the rule that they are legally required to enforce? And so I think when you can resolve those two things, then you're in a position to begin to address any possible appropriate revisions. And first of all, of course, why has that 30-year-old rule not been fully implemented? Well, there must be some reasons, and I think you need to articulate those. For example, inadequate technical assistance. Is it too complicated for some communities? Do they not understand what it is? Is it a cost issue for some communities? Are they having difficulty with the monitoring? The monitoring is unusual, and so that could be difficult, and that could be modified. Or is it just a low priority? Have people decided that it's not that significant in their situations? I think it's worth addressing all of those possibilities, or the combination of those possibilities, and then determining how to fix them one by one. Now, once you've done that, then you've got a basis. And so then, but let's go back to first principles. Where does lead come from? It comes from a lot of places, from the taps, old lead solder, old galvanized iron pipe that has been accumulating lead, as well as from lead service lines when the water is excessively corrosive. And I think that's the key. And that's the way the rule is written, is address corrosivity first, and then lead service lines if the corrosivity can't be well enough managed. And that's a very logical way to do it. And it's much, much better than anybody else in the world has done it. Europe, Canada, etc. Much more conservative than them, by the way. And
so 30 seconds.
Yes, and so corrosion control then is the quickest, most comprehensive way of managing, and then picking up on the lead service lines as appropriate. We all know that blood leads are much, much, much lower now than they were back then. They're 95% lower than they were from the NHANES 2. The problem, and there are two remaining issues for implementation nationally. One is, what do you do with that old housing plumbing? That's private property. EPA can't access it. How do you deal with that? Number two, small systems. As always, small systems have the greatest difficulty meeting any regulation. So one last suggestion, and that is, why not include, EPA can't do it, but states can, why not include lead plumbing problems being addressed at the same time that lead paint and other lead exposure issues are addressed? That way the beneficiaries pay. Thanks.
So your time is up. Thank you. Thank you, Joe. Our next speaker today will be Daniel Crawley from Texas. Daniel, are you with us?
I am. Thank you for the time.
Please go ahead with your remarks.
I'm the Director of Governmental Relations at the San Antonio Water System. SAWS, as well as other public water providers, are fully committed to protecting the health through the reduction and exposure to lead in drinking waters and the eventual removal of lead service lines. I want to talk about section 141.92, monitoring schools and daycares for lead and copper. We ask that the proposed new requirement that require public water providers to sample drinking waters and outlets at each school and child care center facilities.
Dan, could you speak up a little bit? We're having a little trouble hearing you.
Can you hear me now?
That's better.
Okay, thank you. The proposed rules to monitor schools and child care centers for lead and copper would require public water providers such as SAWS to collect samples from schools and daycare centers each year that they serve at a 20% rate. SAWS understands the presence of lead in drinking water of school children is an issue and concerns and should be addressed when identified. Our concern is when COVID and child care protection issues make it difficult to enter these facilities. Public water providers are having difficulties getting in to those facilities. Public water providers should also not be financially responsible for testing and replacing infrastructure at the facilities. We urge the EPA to adjust the proposed lead program rules by moving the responsibilities for testing drinking water at schools and childcare facilities from the utilities to the owners of the buildings, meaning the schools and the daycare centers. They are in a better position to do the testing. Our recommendation is eliminate the need for public water providers, employees to enter the schools. The schools and child care centers owned and control these section of the water delivery system under their control and should be responsible for it. The shifting of costs to the owners of the building, the schools and the child care centers, so that the rest of the system is not subsidizing those testing and avoiding any cross-subsidization. Schools and child care centers should be able to apply for grants from the EPA and others to pay for this testing. And then there will be a higher participation by schools and daycare centers if they're responding to the EPA, and in Texas's case, the TCEQ.
Daniel, 30 seconds left in your
Okay.
time.
Additionally, there's a need for an accountable definition of schools and daycares. We recommend the definition should be limited to public schools and daycare centers that are licensed in the community. This would allow the public water providers to have an actionable list of the schools. We would also oppose the removal of calcium carbonate substance as a corrosion control. We see that as a valuable tool in San Antonio and have a long history of using it. We have naturally occurring calcium.
Daniel, your time is up.
Thank you for the time to speak. I do appreciate it.
Thank you very much for your comments. Next up, we have Melissa Mays from Michigan. Melissa, please unmute your line and proceed with your statements.
Hello, my name is Melissa Mays, and I'm a Flint resident, mother, social worker, and advocate for families trying to recover through the ongoing Flint water crisis. 3 days ago marked 7 years since Flint has been served up drinking, cooking, and bathing water through corroded infrastructure, including lead and galvanized steel pipes. I wish I could say I was happy to be here, but it's day 2,560 in Flint's fight for safe, clean water to, again, drink, bathe, and cook in. There's absolutely no good reason, with the billions we have spent to remove lead from gasoline and paint and the 7-year-long public struggle in Flint, that we are still having to discuss removing lead from drinking water. I just want to show, this is a piece of lead pipe from the first home that had a lead service line removed, and I have to use gloves just to handle it, but yet we're supposed to be okay drinking through this. So that doesn't make a whole lot of sense. Anyhow, so Flint has proven over and over that through the ongoing test subject to the impacts of high lead exposure, as well as long-term lower level exposure, how dangerous these neurotoxins are in real time. 3 years after the crisis began, the percentage of third graders in Flint who passed Michigan's standardized literacy tests dropped from 41% to 10%. Before the crisis, about 15% of the kids in Flint required special education services. But according to Dr. Monahan and Atisha, they're determining that about 80% will now require help for language learning or help with an intellectual disorder. And again, that's from Dr. Monahan and Atisha. COVID-19 has hit the Flint area particularly hard due to many people of all ages who are now immunocompromised after consuming the water through these toxin-laden distribution mains, service lines, appliances, and fixtures. And just yesterday, at a visit with my immunologist, I was told that people like me who have developed an autoimmune disorder after drinking contaminated water or for whatever reason are not in a position to take the COVID-19 vaccine, as our immune systems have been confused by the environmental triggers and would prefer to attack our own bodies as opposed to the virus. This once again proves that the terrible situations that we are all facing are made even worse by drinking contaminated water or being exposed to these toxins that we can get rid of and should have quite some time ago. And what can we do? As one of the plaintiffs in Flint's Safe Drinking Water Act case with the Natural Resources Defense Council, ACLU of Michigan, and Concerned Pastors for Social Action that was filed in 2016, we found that our current laws are not at all based on health protective measures, and in fact, do very little to protect people from these neurotoxins that can and are being leached from our infrastructure. We know that there is no safe level of lead for anyone at any time, so it is time to pull the LCR out of 1991 and make these definitive changes immediately. Require all lead service lines to be replaced within 10 years or less. Reduce the action level to 5 parts per billion or less, especially if we're listening to the doctors. Improve monitoring, so both first draw water and water from lead service lines is checked. The current EPA proposed rule requires testing of the 5th liter of water. Okay, not the first draw. So lead release due to corrosive water and interior plumbing will be missed. Require better corrosion control, monitoring, public education, notification, and fix lead in schools, child cares, and where the most vulnerable populations are. With the COVID-19 pandemic showing us over and over again how important it is to listen to medical experts and to make decisions based on the science, public health, and our futures, it should be more than clear than ever that the same types of decisions should be made for our drinking water, as contaminated, outdated, and failing infrastructure is going to continue to spread these damning toxins into our homes and bodies until we put a stop to it. Thank you.
Thank you, Melissa, for your statement. Next up, we will hear from Doris Salarius. I hope I pronounced that properly. Doris, please take yourself off mute and begin your statement.
I'm Doris Salarius. I submitted personal comments to the docket on the rule, and along with many others who submitted letters with similar concerns. We feel that EPA did not listen to us and the rule must be revised. I and others have called on EPA to set an enforceable MCL of 5 parts per billion for lead in our drinking water. They don't come close to this. EPA should also require much faster replacement of lead service lines, starting with those in the poorest and most vulnerable communities. I'm happy to see Mr. Cartuvo call for more to be done on corrosion control. I live in a city without lead service lines, but with premise plumbing full of lead. That's why my drinking water has unacceptable levels of lead, and we have to use filters in our home. The lead is leaching into our drinking water because Portland, Oregon, has never implemented adequate corrosion control. Since 20 years ago or more, the lead and copper rule was begun. So we believe, and I believe, that EPA should require improvement and compliance with corrosion control requirements. The EPA should also work with the FDA to follow the lead of California and require that premise plumbing not be allowed to contain lead. It still contains a small amount of lead, unacceptable because it can leach out. And California is beginning to have a requirement on sale of premise plumbing so that it would not contain this lead. So thank you very much. Those are my thoughts. The rule needs stringent improvement. I especially enjoyed hearing from Melissa, who has worked tirelessly on this issue, and as have many of the others here today. I'm done. Thank you.
Thank you, Doris, for your statement. The next we will hear from Ayoko Tischler. Ayoko, are you with us?
Hi, yes.
Go ahead, please.
Awesome, thank you. So yeah, thanks so much for the opportunity to comment on the lead and copper rule. I appreciate being able to give perspective as well as hear perspectives on these updated revisions. My name is Ayoko. I work at Trupani. We work with private and public sector stakeholders to provide lead testing, primarily in schools and childcare facilities. So communication is something that's really important to us as we will go in to visit homes and facilities across the country. And we recognize that for many individuals, it's their first time learning of how lead and water can impact their own families. So throughout our work, primarily completing lead testing in schools and childcare facilities under the WIN Act, we've interfaced with many community members directly impacted by this work, from school principals to custodial staff, at-home daycare staff, even new parents. We've witnessed firsthand many of those initial reactions to the words lead testing. We hear very often the misconception that boiling water removes lead, or concerns about the amount of water kids are ingesting when brushing their teeth or washing baby toys. Childcare administrators will ask us to come test their homes after we test their facilities. Even in schools, school teachers are trying to frantically explain lead contamination to their 6-year-olds. So with this new revision, we're encouraged by the revision to require public notification within 24 hours to residents whose tap water exceeds the lead action level, as well as requiring utilities to deliver notice and educational materials to customers during water-related work that could disturb the lead service lines. But we want to keep in mind that even visiting a facility to take samples as a proactive measure can be so alarming to some, especially as it triggers a concern, many for the first time, that their families may be drinking harmful water. So it's important to meet this concern immediately with accurate, reliable, and accessible information before testing begins. Education outlining the sources of lead contamination in homes, schools, throughout the water system, coupled with those at-home prevention techniques. Additionally, water utilities need to tailor those resources to be relevant to the locality. There are local organizations, as we've heard on this call, that already exist to educate on lead contamination in specific geographies, to provide those accessible resources and guide towards possible grant or funding opportunities to finance remediation for the most economically vulnerable. Unfortunately, due to the transient nature of lead, the absence of lead in a single sampling event, as we know, doesn't necessarily mean your home is always going to be guaranteed safe from lead. So many families
30
will,
seconds.
thank you, will continue to drink from water whose contaminants fall below the LCR's lead action level. So those resources to educate and prevent lead exposure must be provided to families regardless of the results, as integrating safe drinking water practices in any case is the most accessible preventative measure, as we know lead service lines will not be replaced immediately. Thank you.
Thank you so much for your statements. Before we hear from any more of our speakers, we're going to take a slight pause to get the rest of our speakers on board. Let's give it 15 minutes to catch up so I will stay on visually so people have a cue, but our listeners can take a break. So please join back in 15 minutes. For those of you just joining, we're on a short break to allow us to catch up with a few speakers that hadn't joined us yet. We'll be taking a break for another approximately about 10 minutes. For those of you just joining, we are on a short break. We'll resume hearing your statements at around 1:25. Please stand by. Thank you. Thank you again for those that are with us. We are on a short break. We will begin the revised lead and copper rule public listening session in approximately 5 minutes at 1:25. Please stand by. Thank you. I'd like to invite our listeners to join us back on screen, please, so we can get started. Great, thank you. Thank you again for the pause. We are running a little ahead of schedule, so we wanted to make sure we got all of our speakers on the line before we proceeded. Just to recap, a reminder, each speaker will be given 3 minutes to provide us with your statements. At 1 minute remaining, I will turn my video camera on to give you a visual clue. And then at 30 seconds remaining, I will give you a verbal cue that your time is running out. And when I hold up this red card, it will mean your time is up. And with that, I'd like to go ahead and get started and invite Lindsay McCormick from Washington, D.C. to unmute your line, both your Zoom as well as your computer or phone, and begin your statements.
Hi, good afternoon, and thank you to Dimple, Eric, Anita, and Karen for taking the time to listen to public comment today. My name is Lindsay McCormick, and I'm a program manager with Environmental Defense Fund, and my comments today are going to focus on the schools and childcare monitoring provisions of the rule. While EDF fully supports lead and water testing in learning environments, we're concerned that the agency has overlooked several major issues, especially in the childcare context. First, these provisions completely ignore lead service lines, which can be found particularly at home-based childcare. Not only are lead service lines the largest source of lead in water, but if they're present, it will be nearly impossible to pinpoint the source of lead through the simple water sampling in the rule. EPA should address these shortcomings by requiring utilities to cross-reference the LSL inventory and the schools and childcare list, to prioritize lead service line replacements in such locations, and to inform the testing schedule to ensure testing occurs after lead service line replacement whenever possible. Second, the sampling scheme is extremely limited, including only a single first draw sample at 5 taps at schools and 2 at childcare. This runs contrary to EPA's own 3T's voluntary guidance that recommends that all outlets possibly used for water consumption be tested. Because lead contamination in fixtures is typically localized and unpredictable, such a limited sampling scheme may create a false sense of security for facilities that receive negative results. And this issue is compounded by the changes since the proposal, where ongoing sampling is replaced by upon request sampling. Third, the rule places the burden of fixing high levels of lead onto the schools and childcare facilities themselves, which is further complicated by the lack of an action level in this context. This leaves often under-resourced educational facilities with the difficult task of grappling with how to address lead sources and the cost of that decision. We're also concerned that EPA's new requirement will not be successful in isolation. If state licensing agencies and local health departments are not requiring or promoting testing, childcare facilities in particular may not cooperate. And finally, I want to make 2 more detailed comments. First, EPA should not limit utilities from getting started on testing prior to the 2024 compliance date. Under section 141.92C, the current rule limits a water utility from earning credit for early testing absent state approval.
Lindsay, 30 seconds.
Great, thank you.
Thank you.
And second, there seem to be continued issues in the economic analysis regarding which states will be eligible for a waiver for childcare, such as inclusion of Oklahoma and exclusion of Illinois, which should at least be eligible for a partial waiver based on its extensive testing. Thank you for the opportunity to comment today.
Thank you for your statement, Lindsay. And next we'll invite Ray Burrows from Florida to make your statement. Ray, please unmute your line and begin your statement.
Hello?
Yep, we can hear you. Thank you. Please go ahead.
I represent a large community water system. We had a lead action level exceedance during routine reduced triennial sampling. We don't have any lead service lines in our system. It seems like the homes that had the hits, had lead solder or older plumbing and some brass fixtures and stuff. It seems like the new rule just has an onus on lead service line replacements. And as I said, we don't have any lead service lines. We'd like some guidance on our issues. Thanks.
Thank you, Ray, for your comments. Next up, we will invite Alicia Hood from Massachusetts to please join us. Alicia, are you with us? Do you want to unmute your line and give us your statements?
Hello, yes, I am here today. I did just mean to sign up just for the listening session, so no comments from me today.
Okay, thank you.
Thank you.
With that, it is going to put us a little ahead of schedule again. So we're going to take another 10 to 15 minute break, and we'll wait for the next speakers to join us online. So we can take a break and we'll come back in about 10 to 15 minutes. Thank you. Thank you, everyone, for your patience. I just want to take this opportunity. We're on a short break while we're a little bit ahead of schedule, so we're allowing some of our other speakers to log on. But I want to remind you that you can submit your questions to the docket, or your written comments and questions to the docket at www.regulations.gov, and also using the docket number EPA HQ OW 2021 0255. We'll be joining again in about 10 minutes. Please stand by. Thank you. Thank you, everyone, for your patience while we help some of our speakers get online. We are on a short break until we can get the remaining speakers patched into the Zoom. So if you could just give us a few minutes and we'll be back in about 5 to 10 minutes. Thanks so much. Thank you all for your patience. We're still working with some of our speakers, but I just wanted to remind you all that you can submit written comments to the docket at www.regulations.gov and using EPA docket number EPA HQ OW 2021-0225. We'll be back online in just a few minutes. Thank you. Thank you all for your continued patience while we get some of our speakers online for them to provide us their comments. Just a reminder to submit any written comments that you have to our docket at www.regulations.gov, docket number EPA HQ OW 2021-0255. And we'll get started momentarily. Thanks for your continued patience. We really appreciate it. And your comments are important to us. So we want to help folks who are struggling a little bit technologically to get online. We want to make sure we can hear from them. Thanks so much. I just wanted to ask folks if there is anybody on the call right now who is scheduled to speak and is either calling in or logging in under a different username or wants to speak, to please email the questions and technical support email at lcrr@epa.gov. Again, if you're wanting to speak, if you're on the call and scheduled to speak and are calling in under a different name or phone number or haven't been called yet, please email lcrr@epa.gov. Thank you. Thanks everyone again for your patience. We've had a few of our speakers that have canceled, but we want to make sure that we keep this session open to ensure that our speakers that have signed up and have times later in this session as their speaking time, that we allow them the time to log on and present us with their comments. So thank you for your patience. We will continue to keep this line open so that we can await some of our speakers that have times scheduled a little bit later in this session. So thanks again for your patience, and we will continue to wait for our other speakers. Thanks so much. Thanks everyone again for your patience. I'd like to go ahead and invite our listeners to join us back online. Thanks so much, everyone. Just to remind everyone, we will be allowing each of our speakers to have 3 minutes to give us their statements. And at 1 minute, I will turn my camera back on, giving you a visual cue that your time is almost up. And at 30 seconds remaining, I will give you a verbal warning that your time is running out. And then when you see me hold up this red card, it will mean that your time is up. And I would ask you to please conclude your statements. So with that, and that we have our listeners back online, I'd like to invite Carla Morris from Maryland to join us and provide us with your statement. Carla, unmute your line and on both Zoom and go ahead, please.
Thank you so much. Good afternoon, everyone. And my name, as you said, is Carla Morris. I'm from Potomac, Maryland. I'm a mom of 2 boys. I am a passionate PTA president at our local high school, and I'm also a vice chair for a brand new Montgomery County PTA organization on diversity, equity, and inclusion. I hope I am a good defender of human rights and civil rights, and my heart goes out to all of the children in our nation, and especially our Black and brown children who do not always have advocates to fight for them when they face so many dire challenges. Lead-contaminated water, with its serious health impacts, even at low levels, is one of the most serious challenges our lower-income families are still enduring nationwide. As you know, it can lead to a lifetime of physical growth problems, anemia, hearing loss, heart disease, and behavior disorders, high blood pressure, and kidney disease. My family lives about 30 minutes from Baltimore. As in many parts of the US, our region is a story of haves and have-nots. While lead pipes are rarely a problem in Montgomery County, in nearby Anne Arundel County, where Baltimore resides, it continues to be a huge challenge and also, of course, a huge discriminator. According to the Centers for Disease Control, there is no safe amount of lead in children's blood. Even a 1 level of microgram per deciliter of blood of this is harmful and sometimes deadly neurotoxin, enough to lower IQ by several points. It obviously wreaks havoc on mind and body. It can create irritability and mood disorders, appetite loss, and all sorts of symptoms of exposure can lead to developmental delays. According to the University of Wisconsin-Milwaukee School of Public Health, a sugar-sized packet of lead dust throughout a 2-bedroom home is enough to create a lead-poisoned child. For decades, lead served as a critical component in the pipes, paint, and petrol of Americans' rural and urban topography. Over the second half of the 20th century, as evidence piled up regarding, the negative health effects generated by chronic low-level exposure, the law finally caught up. And starting in the 70s, as we know, federal provisions gradually took effect to restrict or ban lead-based paint, leaded gasoline, and the use of lead pipes in plumbing. But the specter of lead still looms in cities across the country, and its effects continue to be felt. In Newark, New Jersey, where improperly treated drinking water corrodes the city's lead service lines, it allows that element to flow throughout residents' faucets, and it's, of course, quite toxic. Most studies show, and according to the CDC, about 500,000 American kids between the ages of 1 to 5 still have a blood lead level that exceeds that 5 micrograms per deciliter. And as we know, it's a problem that disproportionately affects our children of color. The impact of this contamination on American cities is enormous. One hypothesis suggestion draws a direct connection between lead exposure as a child and crime later in life. It's a correlation with lower test scores and higher rates of criminal activity. Roughly $15 billion is spent in the US annually to handle new cases of lead poisoning, money that could be much better spent in other ways. Fully eradicating lead toxin in our towns and cities means replacing 7 million lead service lines and remediating the lead paint in 38 million housing units, cleaning up countless tons of soil contaminated by lead spewed into the air by automobiles. And one price tag is estimated at about $500 billion. That is a pretty daunting.
Seconds left, Carla.
Thank you.
Thanks.
We must make sure that our lead removal programs do not leave our low-income and minority households behind. And we must act fast and thoroughly to stop this ongoing assault on the children of our nation. Thank you so much.
Thank you, Carla, for your statements. We are again going to take another pause until about 2:20 while we await our next speaker to join. So we'll give our listeners time to take a break, and we'll be back with you at 2:20. Just a reminder for everyone today who's joining us, in addition to your verbal comments, we welcome you to submit any additional written comments to the docket at www.regulations.gov using the docket number that you see here on your screen, EPA HQOW 2021-0255. And we'll be starting up in about 4 to 5 minutes, awaiting our next speaker. Thanks so much for your patience, and stand by, please. I'd like to go ahead and welcome our listeners back to the screen. It looks like our last remaining speakers are now not going to be available. So we will go ahead and wrap up this session. I want to thank all of you so very much for your participation today. I'm now going to turn it over to Dimple, Eric, and Anita as our listeners to make some closing remarks. Dimple?
Thank you so much, Karen. We just wanted to thank everyone that participated in today's listening session. EPA appreciates the time you've taken to join us and provide input on important issues surrounding lead in drinking water. As Karen mentioned, we invite you to submit additional comments, written comments to the docket at regulations.gov. And thank you again for your input on this very important issue.
I'd like to add my thanks to those provided by Dimple. We appreciate everybody participating today. We also appreciate your patience. Obviously, while we're a year into the pandemic, making Zoom meetings work is still a challenge for many of us. And we appreciate that you took the time today and folks that signed up and waited online patiently to hear from commenters, because it's important that we all hear these perspectives. So thank you for patience and thank you for your input.
And I want to ditto what Dimple, Eric, and Karen have said. Thank you for your patience and thank you for your input on this very important topic. Thank you.
Thanks so much, Eric and Dimple and Anita. I also would like to remind participants to submit your written comments to the docket at regulations.gov. And the next listening session will begin at 5:30 today, Eastern Time. And if you're interested in viewing that session as well, you may watch it on a live stream by following the instructions that are on our website at www.epa.gov/safe-water. So this concludes the LCRR public listening session for this listening session for today, and you can join again at 5:30. Thanks again, everybody, for joining us.